Okay, good evening, everyone. My name is Sumedh Kaul. Recently graduated with a Master of Science degree in biostatistics from New York University's School of Global Public Health. And I volunteered at Larkin Health System in South Miami, Florida. And recently, I've also started my position as a biostatistician at Beth Israel Deaconess Medical Center in Boston, Massachusetts. So today I'm going to give a presentation on modeling and forecasting for COVID-19 spread in Miami-Dade County, Florida. So this is one of my projects which I done at Larkin Health System. So as we all know, coronavirus disease 2019, also known as COVID-19, is a viral respiratory disease which is caused by a new coronavirus. It was first reported in Wuhan, China in November 2019, and the illness spread to all over the world over time. It was declared a pandemic disease by the World Health Organization on March 11, 2020. And the significance related to this project is that the researchers have made several attempts to understand the transmission pattern of the disease by building forecasting models, and they have started able to understand the dynamic changes in COVID-19. So in one of the publications by Futela and colleagues, total confirmed cases were predicted for the next 10 days by the Profit's logistic growth model on an Indian data set. Wang and colleagues integrated the most updated COVID-19 epidemiological data before June 16, 2020 into the logistic model to fit the cap of epidemic trend, and then feed the cap value into Facebook's profit model, which is a machine learning based time series prediction model to derive the epidemic curve and predict the trend of the total confirmed cases at the global level, as well as in countries such as Brazil, Russia, India, Peru, and Indonesia. Doan and Zhang predicted the daily new confirmed cases for the 7-day period from April 27, 2020 to May 3rd, 2020 in Japan and South Korea by the autoregressive integrated moving average or ARIMA model. And Dahesh and colleagues also predicted a trend of COVID-19 cases in countries like Italy, Iran, Thailand, and South Korea using the same ARIMA model technique. The main gaps in the literature were that there is limited research on COVID-19 forecasting model, and due to the paucity in the data collection, and research is still going on to develop a robust model. And the forecasting on prediction models that have been built so far are mostly at the global or the country level. There is no model that has been built at the county level in the literature as of present date. And many models that were built till date, they are predicting cases and deaths for a very short period of time. The model that we have built is doing long-term forecasting. Therefore, this study or project aims to build 2 to 8 weeks of projections of cumulative cases and deaths, new cases and deaths per day in Miami-Dade County. And forecasting will give better estimation to model the spread of coronavirus cases and deaths and predict future points in the time series analysis. The data for mapping projection graphs was used from the US counties dataset from the NY Times website. And the measure for this study was to predict number of cumulative cases and deaths, new cases and deaths per day for 2 to 8 weeks on the basis of current cumulative cases and deaths per day using Facebook's profit logistic growth model and ARIMA model respectively. The data predictions were started initially from confirmed cases and deaths from 11th March 2020 to 30th June 2020, and forecasting was done till 25th August 2020. The models were updated on a weekly basis to include more data points in order to bring more accuracy in the results. And all the statistical analysis were done in R version 3.6.3, and descriptive statistics, that is univariable analysis, was performed, and we will discuss the graphs in the future slides. And next, I would like to discuss the mathematical theory of Facebook's profit logistic growth model. So the idea of the algorithm is to select a suitable training model according to the characteristics of the historical data and use it to predict the future observation results. When forecasting growth, there is usually some maximum achievable point. So total market size and total population size, etc. And we applied the same technique to COVID-19 forecasting in the real world. So Profit, which is an open source framework of Facebook, was open to the public in 2017. And the non-linear trends of profit are fitted with yearly, weekly, and daily seasonality plus holiday effects. The profit function can not only predict the future, but also fill in the missing values. So in profit, the prediction model consists of superpositions, that is y of t, which is the outcome, which equals to gt, which is a trend function used to analyze the non-periodic changes of time series. And S of t is a periodic term reflecting the periodic change, such as the periodicity of a week or a year. And H of t is the influence of an occasional day or days such as a holiday. And epsilon of t is an error term on behalf of the failed to consider the effect of the error of the model. So here in our research, we only considered about the non-periodic changes of time series. And in R, this equation or algorithm is run by building a data frame used in Profit, and it requires two columns. The first column is DS, which is used to store the data time series, and Y to store the corresponding values of the time series in the data frame. So based on this mathematical equation that the Facebook has founded, we predicted cumulative COVID-19 cases, and it's in Miami-Dade County in Florida, and checked the model performance by regressing predicted values given actual values, and finally obtained the R-squared value from the model. Next is the ARIMA models. So the ARIMA models are in theory the most general class of models for forecasting a time series, which can be made to be stationary by differencing, if necessary, perhaps in conjunction with nonlinear transformations, such as logging or deflating. A random variable that is a time series is stationary, if its statistical properties are all constant over time. And the acronym ARIMA, as I discussed before, it's an auto-regressive integrated moving average. So the lags of the stationary series in the forecasting equation are called auto-regressive terms, and lags of the forecast errors are called moving average terms. And a time series which needs to be differenced to be made stationary is said to be an integrated version of a stationary series. So a non-seasonal ARIMA model is classified as an ARIMA, and the parameters which are defined are here as P, D, and Q. So the P is the number of autoregressive terms, and D is the number of non-seasonal differences needed for stationarity, and Q is the number of lagged forecast errors in the prediction equation. The forecasting equation
is 5 minutes.
Follows. So first, let's consider y denominator dth difference of y. So which means if d equals 0, small y equals capital Y. And we can note that the second difference of y, d equals 2, is not a difference from 2 periods ago. Rather, it is the first difference of the first difference, which is the discrete analog of a second derivative. That is the local acceleration of the series rather than its local trend. So in terms of y, The general forecasting equation we can see here, and here mu is the autoregressive coefficient, and phi is the slope coefficient, and thetas are the moving average parameters with E, that is error terms. So here the moving average parameters, thetas, are defined so that their signs are negative in the equation, following the convention which was introduced by Ben Box and Jenkins. And some authors in software like R define them so that they have plus signs instead. So in R, the differencing transformation was used to achieve stationarity on certain non-stationarity time series. And the augmented Dickey-Fuller, that is ADF unit root test, was also introduced to identify stationarity in the data. And the R package T series and forecast were implemented to produce the numerical output for ARIMA combining parsimonious parameter models. So we got the orders of ARIMA model as ARIMA 011 in predicting cases per day, and ARIMA 111, that is the values of PDQ, in predicting deaths per day. So, and next we will discuss the results. And the figure 1 shows the daily number of cases over time. We can see from the graph that there has been a spike of cases from the end of June to the end of July. And in the figure, when the models, which was first updated on August 12th, 2020, there were 1507 cases on August 11th, 2020. So figure 2 shows the cumulative number of confirmed cases over time. And there were 135,129 cases on August 11th, 2020. Figure 3 shows the daily number of deaths over time. So there has been a spike in mid-June to end of July, mid-July to end of July, and there were 35 deaths on August 11th, 2020 when model was last updated. And figure 4 shows the cumulative number of confirmed deaths over time, and there were around 1909 deaths on August 11th, 2020. So the figure 5 is the graph from the profits logistic growth model. So we can see from the graph that the increase in the actual number of confirmed cases over time. So we can see the black dotted lines. These are the actual number, and the predicted numbers of cases over time are blue lines. So we can see they are actually in line, and the predictions have been accurate. So there are in total, when the graph was last updated, 177,000 cumulative cases were predicted on August 25th based on the current data. And figure 6 shows the increase in actual number of deaths over time. So black dotted lines are the actual lines, and predicted number of deaths over time with blue lines and the interval. And there are in total 2,220 cumulative deaths that were predicted by August 25th. And the R-squared value of both the models were 0.99, and that was statistically significant.
You have 1 minute.
Figure 7 shows the predicted number of cases per day over time, and there are 1550 predicted number of daily cases on August 25th. And figure 8 shows the predicted number of deaths per day, and there are 31 predicted number of daily deaths on August 25th. So these are the main findings which I discussed from the previous slides. And so the conclusion is that it was found that the actual and predicted cases were similar in trend, and the model performance was also good to predict cases and deaths. And the developed model can be used for predicting cases and deaths based on the historical data available for any county. And the model, but the model was unable to capture the historical records like infection rate, recovery time, and exposure time. And model has to be updated regularly. And in the future research, cross-validation technique can be used to assess the model performance. And if the historical data is retrieved, we can actually use artificial intelligence methods and see a model that is susceptible, exposed, infectious, recovered, and deceased model. So I would like to thank my environmentals for their valuable teachings, and Dr. Kinal Bhatt and Dr. Jack Michelle and Dr. Makos for introducing me to this project, and also Larkin Health System faculty members and data science conference members for selecting this project. Thank you.